Assalamu alaikum everyone. I welcome you all to the knowledge transfer session episode 4 by Revive Medical Technologies. I am Muhammad Talha, Embedded Systems and Software Engineer at Revive Medical Technologies. And the topic for today is Healthcare 2.0 and Generative AI's revolution in healthcare. And today we're going to discuss the evolution of healthcare, what is generative AI and its impact on in healthcare. But before we get started, I have a question for all of you. You all might remember the Disney's Big Hero 6 and the very lovable and soft healthcare assistant in it, the Baymax. And my question from all of you is Baymax possible today? As technology has advanced, do you really think it is possible to develop such healthcare assistance which is dedicated to assist the individuals based on their specific constraints and specific limitations? We'll get back to this at the end of this session. Let's get started. So healthcare has come a long way, starting from the natural remedies, herbs, and the spiritual practices. Jumping to the 19th century, the world noticed the advancements in surgical techniques, anesthesia and germ theory, and medical education and medical societies were formally established in this century. And in the next 20th century, antibiotics and vaccines revolutionized disease treatment and prevention. Hospitals, specialized medical doctors, and rise of modern healthcare systems were observed in this 20th century. And one of the special things that were found in this 20th century were the introduction of health insurance and the involvement of government in this sector. After in the late 20th century and in the early years of 21st century, what we know it as today is healthcare 1.0. The world noticed the digitalization of healthcare records known as EHRs, electronic health records today. The world noticed advancements in the medical imaging, diagnostics and pharmaceuticals. Also, the technology, with the help of technology, the focus of the treatment was shifted from one fits all to a patient-centric approaches. What comes next? The next is healthcare 2.0. It's in the present, it's already started yet, and it is the future. Healthcare 2.0 consists of the advanced technologies including artificial intelligence and genomics, integration of AI with the existing technology, integration of AI with the existing diagnostic methods, diagnostic machines and all. Also, there's a pretty prominent emphasis on telemedicine, remote patient monitoring and data-driven healthcare solutions, and ongoing efforts are being placed to address healthcare disparities and improve global health outcomes. You see, the critical element in the healthcare 2.0 is generative AI, the AI. But what is generative AI? Generative AI is a subset of the artificial intelligence that employs advanced machine learning techniques to automatically create new and contextually relevant content. Unlike the traditional AI, generative AI does not follow any rules. Like in the traditional AI, you have to train the model, you have to provide it the inputs, you have to expect limited output from this model. But in generative AI, there is no rule for such output, because generative AI has the ability to innovate and generate outputs without explicit programming. Those outputs could be text, images, or even audio signals. For example, we have already seen the boom of OpenAI's ChatGPT, It's natural language processing based generative AI. The second one is Google's Bard AI, which is also very similar to the GPT. The third one and the fourth one, GitHub Copilot and Alpha Code, they are generative AIs that assist the developers in writing the codes for their applications. Quoting Elon Musk, the founder of SpaceX and Tesla here, generative AI is the most powerful tool for creativity that has ever been created. It has the potential to unleash a new era of human innovation. So, moreover, we're going to discuss some of the revolutions that have been already happened, and some of them are the ideas that the potentials that generative AI holds in itself, specifically in the domain of healthcare. So we have already seen in the time of a global pandemic during the COVID-19 how traditional AI methods and how traditional AI models have assisted the clinicians and the lab technologies in the diagnostics of medical images. Imagine a model in which you provide the image and you expect it not only to deliver the result by simple classification, but it also does an extensive analysis on that image and provide you literally an analysis from all the angles. That comes under the umbrella of healthcare diagnostics. Generative AI can analyze medical images, genetic data, and patient records to provide accurate and early disease detection. Similarly, from such cases, if we get early stage diagnosis by a generative AI, that same kind of generative AI model, it can propose a personalized medicine for that specific individual. It can tailor the treatment plans based on that individual's genetic makeup and predict the most effective therapies that could be useful in the timely and most efficient treatment of that individual. The next comes drug discovery and development. Generative AI can not only help the drug developers in the composition process, but it can also assist them in the clinical study that is supposed to happen after the discovery and development of the drug. Generative AI can analyze massive amounts of dataset to identify potential drug candidates and predict a number of efficiency that is going to be observed in that by that drug. Yeah, imagine having a doctor who is available for you 24/7, whether it is a remote area or it is in city or in access to everyone. There comes the generative AI as virtual health assistants. It can provide 24/7 healthcare support. It can enhance remote consultation and automate the process of appointments. The next is the preventive care. Now, it is a very critical process here. Generative AI can, being an efficient AI model, what it can do is it can focus and it can highlight those details that might be missed by the clinicians or the physicians. Preventive care by preliminary data analysis is very efficient, specifically if it is done by using generative AI. It can identify individuals that could be at a risk of developing certain disease. This would allow for proactive interventions and preventive care. The next thing, the clinical assistance to the physicians can be provided by generative AI. You all might remember Jarvis in the Iron Man series from Marvels. Yeah, Jarvis was for that engineer, and imagine such a clinical assistant for physicians, for surgeons. it could not only assist you in the clinical procedures, but it could also assist you in the research and development of such domains. It could assist you in analyzing vast amount of medical data sets. It can provide insightful diagnostics. It can support informed decision making for personalized patient care. Medical research and recommendations, generative AI could be very helpful in this domain. The doctors don't need to scroll through all the internet and all the books that are available on the market or on social media. They just have to insert their query in the generative AI, and generative AI can do all their work for them. It can analyze extensive medical research data. It can offer valuable insights and facilitate the evidence-based recommendations for advanced medical research. Now, there comes the interesting part. The generative AI, it can not only assist the healthcare professionals such as physicians or the clinicians, it could also assist those who are the managers of such healthcare industries. Generative AIs can enhance risk management through predictive analytics. They can anticipate the market fluctuations and make informed decisions regarding the investment plans and investment decisions. They can also do some kind of some hefty task for you, like human resource management, some human resource shortlisting and hiring, etc. Generative AI could be very helpful and very efficient for such purpose. Now, the legal documentation is very critical for the clinicians and sometimes felt as a very hefty task. So generative AI covers this side of yours. It could improve the document preparation process. Also, it can review the documents that you are preparing or the documents it is preparing through the use of advanced natural language processing algorithms. There are already some of the algorithms available by OpenAI's like GPT, DALL-E, and some others. They could be useful. Customized training, by customized training, they could be helpful in achieving those local documentation goals. Generative AI envisions a future where personalized medicine, precise diagnostics, and compassionate care converge seamlessly for improved health care. This is the vision that ChatGPT envisions for the future of this world. Okay, getting back to our question, is BMX really possible? So the answer is yes, it is possible with the advancements in the technologies of AI, robotics, mechatronics, biomaterials, and drug synthesis. We have already achieved enough advancements in this domain that we can integrate and we can compile such a healthcare assistant that could provide patient-centered treatment and diagnosis or to the patients. That's all from today. Thank you very much.